Broward Community and Family Health Centers, Inc. is a nonprofit healthcare organization whose mission is to provide accessible, comprehensive, high-quality primary and preventative care services to all persons with dignity and respect. As a healthcare safety net provider, the organization currently operates 3 centers in Broward County, and for over 13 years has continued to improve the health and well-being of the communities by reducing and eliminating health disparities in all age groups. Its structure and management is the foundation upon which all of its services are built. A deeply committed management team works together with the board of directors, staff members, volunteers, community partners, and patients to carry out the center's mission. The journey over the last 13 years has been filled with challenges to overcome, changes to embrace, and milestones achieved. Broward Community and Family Health Center, which was initially named Sawgrass Health Services, was formed at the request of the Bureau of Primary Health Care in February 1998 to provide continuity of care to the people who were left without a medical home following the defunding of another federally qualified health center.
They closed down the health center, Sunshine Health Center, and then they got the grant to open a new center. The biggest challenge we had was the separation part, making people believe that we weren't part of the other organization, that we were a new organization and we were out to help the people. We had a very new board, a very new organization. We didn't have directions. The medical director was doing everything. We didn't have the correct CEO. We didn't have the correct organizational skills.
I love serving the community. I love serving people in need. So I decided to accept the position. I came right out of my residency and accepted the position as the medical director. And we determined that we needed to start to practice and establish care for the community. We wanted a sense of the people to feel that the health center was a part of the community. And so the board of directors changed the name to Broward Community and Family Health Center. And that was the philosophy, culturally sensitive healthcare to people that truly need help.
And so with the formation of Broward Community and Family, the feds were very instrumental in bringing both hospital districts together to say, look, we want to commit to this community and we want you all to be a part of that commitment to this community in assuring that Broward Community and Family, it wasn't called Broward Community and Family at that point, they hadn't even named it yet, but assuring that their federal investment stayed in place in this county.
When Sunshine Health Center left the area, we really welcomed Broward Community Health Center into the area and have a community partner. We don't have to do this all ourselves. We don't have to control everything. It's really important to have community partners.
We felt that it was our job as a partner to step up, and we supplied both some interim financing and some office locations and some legislative support for the reenactment of the health center.
We were having difficulties securing a CEO, and so we took our case to Betsy.
Betsy Cook was the first president and CEO of Health Choice Network, a not-for-profit coalition started by a group of community health centers who shared a common mission of expanding access to health care and an interest in collaboration to forge closer operational relationships. Under Betsy's leadership, Health Choice Network became recognized as a national model by the Health Resources and Services Administration's Bureau of Primary Health Care. An inspirational leader, an honored professional, a tireless advocate, a trusted friend, Betsy will always be remembered fondly by Broward Community and Family Health Centers and everyone whose lives were touched by her warmth and her wisdom.
She, as well as Jesse Trice, led to the development of the Health Choice Network. And at the time, Broward Community Health Center was the only health center in Broward County, so it was imperative that Broward Community Health Center be a part of Health Choice Network.
I became involved with Broward Community Family Health Centers actually before it was even named that. It was Sawgrass Community Health Centers. It was about 2001. They were looking for some assistance with their computers, their billing and registration systems. and we became involved at that time. It was a different time for the center at that point, going through a lot of transition. And shortly after we became involved, they were looking for a new CEO for the Community Health Center. And along came Rosalind Frazier, and the rest, as they say, is history. And it's been a wonderful relationship ever since.
By May 2002, BCFHC had experienced 4 CEOs. The board of directors set out to secure a leader who could embrace the mission of the board and take the health center to the next level.
We had a lot of false starts and stops, and we decided that what we needed to have there was someone who had experience, someone who had expertise in dealing with all the issues of a community health center. She was everything we needed and more.
Ms. Frazier came in with tenacity and strength and got the word out to the community that we existed. Back then, we didn't have an outreach program, and we would all go out to health fairs and church functions to recruit new patients. And it really worked because within a few months, our patient load more than doubled.
First, I'd like to say I'm very proud to be the CEO for Broward Community Family Health Center. It's been 8 years now, and it's been a tremendous adventure, and we've had many challenges, but I'm very proud to be their CEO. What's so amazing about being the CEO here is the heart of the staff, our board who has vision, who have become very good leaders for me. I'd say that some of our major accomplishments includes increasing our users and our encounters. They approximately have increased over 50%. Our operating budget and our total assets have increased more than 50%. We've actually had a 64% increase in our staffing. When we started here, there was 13 employees. We now are up to 36. We've increased access to care by adding a new site in the city of West Park. The biggest highlight of my career being here is when the announcement came forward regarding the health center receiving funding to expand services. Congresswoman Wasserman Schultz contacted me about that funding, actually called me at home personally.
We've been able to enhance our management team from a team of 3 to now a team of 9 very committed individuals who have been very crucial to the success of our operations. In 2008, we were able to become accredited by the Joint Commission, which allowed us to not only improve the quality of care to our patients, but also the safety of the care that we provide. We've been able to implement several disease management programs through our outreach department, like our Healthy Body, Healthy Soul program, which focuses on breast and cervical cancer prevention in minority women. We also have our smoking cessation program, which is a partnership with Nova Southeastern University.
So Nova Southeastern University is very proud to be directly involved with the tobacco prevention and cessation program. It's been a winner for us, and
Absolutely.
We hope to expand it.
BCFHC has been successful in improving clinical outcomes by first being very attentive and aggressive with the patients. What we do is we try to put systems and measures in place to pay attention and understand the patient population that we try to serve. That and close monitoring of the information that we're getting allows us to improve upon the data that we get, and subsequently that has resulted in better outcomes, better measures, and the patients are in turn satisfied with the results that we are getting.
Technology has played a critical part. So the automation of the practice management system, the appointment scheduler, the electronic health records, the automatic patient reminders, the ability to run reports automatically at night allows for the staff to really focus in on their mission of serving the patients and not really have to worry about the computers.
With the addition of Broward Community and Family Health at Health Choice Network, I think it's been a great opportunity for them to make sure that they have the latest and greatest in technology. They were some of the early adopters in the electronic health record, which has been just a great thing for them and for their patients. And I think it's allowed the health center to continue to be in the forefront, continue to be leaders in the community health center and delivery of primary care to the safety net community.
We have 4 focus areas that we are prioritizing: primary care, healthy lifestyle promotion, oral health, and preventive measures. And when it comes to primary care and healthy lifestyle promotion, Broward Community Family Health Center is right at the top of our list for support and grant making. We've given 3 grants in the last few years to Broward Community Family Health Center, one for outreach, one for electronic health records, and one for diabetes management. The investment in this center from grants from the Health Foundation is nearly $300,000. And it's been done over a period of the last 5 years, especially under the leadership of Rod Frazier, who we have a lot of confidence in and believe we're headed in the right direction here in Broward County.
It was an absolute pleasure to partner and collaborate with Broward Community and Family Health Center to use it as a major training site with its excellent staff and its nice facilities and its dedication and commitment to providing primary care services to the underserved, which is precisely what our mission is itself.
We see Broward Community and Family Health Center as one that could provide the level of quality that's necessary for our students and our residents in terms of our training situation and being able to be community-based and community-focused. And that's part of the mission, would you say, of our university.
Certainly.
Is to make sure that there is a collaborative and participatory relationship with the community.
We've made the locations, your location, our locations, central to the population in need.
It's really there to benefit the health status of the community we serve, and I think together that's what we've been able to accomplish.
Broward Health is a large provider with a fair number of access points for patients that are struggling with insurance and healthcare needs. Clearly the FQHC has been another support system for those folks to help us meet our mission of taking care of the uninsured and the underinsured.
And it'll be interesting as time goes on, especially as the numbers of people that we have coming into care, that there are additional other spots for access points. Broward Community and Family offers those access points in both the south end of the county and the north end of the county. Our service area is the north end of the county, and we could definitely use all the help we can to ensure that people have good quality care and where they go to receive their care.
Welcome to Broward Community and Family Health Center. How can I help you?
Health centers have always been an integral part of America's healthcare system. Spread across 50 states and all U.S. territories, there are 1,250 community health centers that provide vital primary care to 20 million Americans with limited financial resources. As the nation moves forward to implement a fundamental overhaul of the American healthcare system, community health centers will play a critical role in making the health reform vision a reality. Broward Community and Family Health Center is proud to be a part of this movement and looks forward to continuing its journey.
As Broward Community Family Health Center embarks on this new journey toward excellence,
Patients now are going to have a choice as insurance becomes more available for those within our community.
I envision that we'll continue to grow and continue to provide great quality health care.
To be able to do this in a team effort, that more access points will be needed rather than less.
That you have both system as well as clinical integration.
Our people, our patients have no problem with coming in.
We want to make sure that they're aware of the community health centers and that we are their medical home of choice.
Broward County will be very well served by the leadership under Rosalind Frazier and Felicia Hart of incorporating technology in that journey.
They really do care about people.
Yeah.
Broward Community Family Health Center has a very bright future as we continue to increase access, improve outcomes, and expand our services to meet the needs of our patients as well as the community at large.
What will make this journey in the new era of community health successful will involve collaboration and partnerships across service providers. not just with primary care, but with specialty care, enhancing and improving our customer service efforts, improving the medical technology, empowering our patients to take a more active role in their health care and that of their families. But most importantly, I think it's going to be vital that we continue to educate our legislators as they start to define what our healthcare system will look like. I'd like to thank you for supporting Broward Community Family Health Center as we venture this journey through community health. I'd like to end with this quote from Charles Darwin. "It is not the strongest of the species that survives, nor the most intelligent, but the most responsive to change."